Thank you very much. I would have given my colleague from San Diego a heads up if I knew that it was coming up today, but this is my heads up. I believe in science. I am fully vaccinated. My family is fully vaccinated. And I believe that we do need to promote vaccinations so that we accomplish the herd immunity at all schools in all communities. But I also feel that while the goal and the intent of this bill is the right goal, that this bill is not the right solution. I agree with my colleague from the San Fernando Valley that if there are bad actors, we should focus on the bad actors. There are also two other major concerns that I have. One, which I had a chance to talk with the author of the bill, Dr. Pan, which is the concern about a chilling effect on legitimate medical exemptions. You know, as a lawyer, I know that if I knew that if I did something that it would trigger inquiry and a review by a public agency, whether the Department of Public Health or the State Bar of California, that I would be reluctant to engage in that activity. And Dr. Pan and I, we both agreed that we want to promote and support legitimate medical exemptions so that children don't get hurt. And yet, when we have this threshold where a doctor issuing 4 or more than 4 medical exemptions, that would trigger the review by the Department of Public Health, that inevitably will have a chilling effect. Especially, I've met with several parents who had to take their kids to a geneticist or an immunologist. These specialists who receive the referrals from the primary care physicians, you know, who specialize in these more complicated or nuanced cases, the cases in the gray areas. And for these physicians, it's easy for them to go beyond the 4 medical exemptions a year. I think, you know, with this limit on this bill, it's going to have a chilling impact on legitimate medical exemptions, and I fear that would be bad public policy that may lead to some children being injured. Last but not least, there is the database. The database now has personally identifiable information being compiled by the Department of Public Health and being able to be shared with other public health agencies. Why do we need to have the personally identifiable information in there? I mean, I think given all the emotions and the volatility of this issue, there are parents as well as physicians that raised with me the concern about being discriminated against for having a medical exemption or for issuing a medical exemption. You know, I think we can imagine, you know, like any other disease that involves sensitive information, say like HIV. If there was a HIV database with personally identifiable information, I think there is a legitimate concern. I don't see the reason why, when we're trying to go after the bad actor physicians, why do we need to compile a database of children and their parents
30 seconds, Mr. Muratsuchi.
that may subject themselves, that may be subject to unlawful or inappropriate access, to hacking. Bottom line, I think this bill is overbroad. It's the right policy goal, but it's not the right solution. I ask my colleagues not to support this bill.